Stop me if you've heard this before. Central retinal artery occlusion is a stroke of the eye. Now this makes sense from the perspective that a blocked artery is causing the loss in vision, but should CRAO be considered for the same treatments as ischemic stroke? Specifically, should patients with a CRAO presenting less than 4.5 hours from onset be offered thrombolytics? The traditional teaching of this was hell yes. We should be making this diagnosis as rapidly possible so that patients can get thrombolytics to improve outcomes. But that recommendation wasn't based on any high quality evidence. Now we have this study, which is the highest quality evidence to date. This group enrolled 78 patients diagnosed with CRAO in a double-blind, double-dummy RCT. 40 patients got TNK, 38 patients got aspirin alone. At 30 days, there was no difference between the two groups in terms of vision recovery, about 20% in the TNK group and 24% in the aspirin group. However, Lytics had a much higher complication rate, including 1 death in the TNK arm from intracranial hemorrhage. Based on this high quality data, patients with CRAO, even those presenting at less than 4.5 hours from onset, should not be offered thrombolytics as there's no evidence of benefit and clear evidence for harm.